July 1976 in Philadelphia shimmered with patriotic pageantry as the American Legion gathered at the gilded Bellevue-Stratford Hotel, a downtown landmark. Amid parades and handshakes, an unexpected cluster of severe pneumonia cases began appearing among delegates. Feverish men started collapsing in their hotel rooms, and hospital admissions mounted. Within days, the number of dead and critically ill rose sharply, turning festive camaraderie into grim alarm. Local physicians were puzzled by the case's severity and by the common link to the hotel. The Centers for Disease Control and Prevention dispatched an investigative team to the Bellevue-Stratford, led by Dr. Joseph E. McDade, to identify the cause and stop further fatalities. Within days of the American Legion Convention held July 21st through 24th, 1976, dozens of veterans began collapsing with high fever and severe respiratory distress, swelling Philadelphia hospitals with men who had stayed at the Bellevue-Stratford Hotel. Local clinicians at Pennsylvania Hospital, Philadelphia General Hospital, and Temple University Hospital reported conflicting diagnoses: atypical pneumonia, influenza, even chemical exposure. Treatments ranged from penicillin to high-dose corticosteroids as patients worsened. Press reports and worried families amplified public alarm, and overwhelmed Pennsylvania health officials formally requested CDC assistance on July 27, 1976. The CDC sent an emergency team led by Dr. Joseph E. McDade, who launched rapid case finding, interviewing delegates, compiling timelines, and mapping possible exposures in the hotel's ornate ballroom, swimming pool, and HVAC systems, hunting for the common thread that would drive the investigation forward. Subscribe. Maybe it will help us solve the case. Time was of the essence. Investigators shifted from fearing person-to-person spread to hunting an environmental source. CDC teams swabbed the hotel's gilded air ducts, sampled tap water, cultured water from cooling towers, and probed plumbing fixtures and the swimming pool. Routine bacterial cultures, gram stains, viral assays, and serologic tests kept coming up blank. Autopsies showed severe lobar and interstitial pneumonia, but no known pathogen, and each negative result raised the tension as Philadelphia newspapers ran front-page headlines and national networks demanded briefings during the bicentennial summer. Governor Milton Schaap and Mayor Frank Rizzo pressed for answers, while the American Legion sought reassurance for its members. As the case count climbed to 221 sick and 34 dead, political and public pressure forced investigators to try unconventional microbiologic methods and to focus more sharply on aerosolized water as the likely culprit. Relentless laboratory work paid off in January 1977 when CDC microbiologist Joseph E. McDade coaxed the growth of a previously unrecognized fastidious gram-negative bacillus from victims' lung tissue. The organism grew only on a specialized medium, buffered charcoal yeast extract agar, and its shape only became visible with specialized microscopy and fluorescent staining after routine methods failed. Parallel cultures yielded the same bacterium from water sampled in the Bellevue-Stratford Hotel's cooling tower, decorative fountain, and plumbing fixtures, linking the microbe to the building's water systems. Epidemiologic mapping and attack rate analysis showed cases clustered among men who had been in aerosol-generating areas of the hotel, while household contacts were unaffected, ruling out person-to-person spread. The match between patient and environmental isolates, together with the aerosol exposure pattern, provided decisive proof linking the bacterium to the outbreak. That discovery led to naming it Legionella pneumophila and kicked off a revolution in building water safety. In January 1977, the CDC identified the culprit, a previously unknown bacterium, Legionella pneumophila, and officially named the illness Legionnaire's disease. That declaration ended weeks of anxious speculation and immediately triggered targeted remediation. The Bellevue-Stratford's cooling tower, fountain, and plumbing were shut down, hyperchlorinated, and inspected, and federal guidance on building water systems followed. The Gilded Hotel's reputation collapsed under lawsuits, insurance claims, and vilified headlines. Survivors faced chronic illness while bereaved families pursued justice. blending bureaucratic reckoning with private grief and setting the stage for lasting public health reform. That crisis produced durable reforms: mandatory maintenance for cooling towers and plumbing, new HVAC and water safety standards, routine Legionella surveillance, and stronger legal and engineering oversight. The outbreak accelerated environmental microbiology and response protocols, embedding culture methods and targeted environmental sampling into everyday public health practice. Joseph McDade's methodical pursuit reshaped modern epidemiology, turning a tragic summer into a practical blueprint that helps prevent future aerosolized waterborne disasters worldwide.